I know. I'm kind of digging that. Good afternoon. It's nice to be back here in Lawrence. I was saying to the mayor earlier that his predecessor, Dan Rivera, sends his regards and obviously misses the city terribly, but also made quite clear that he thinks you're the right guy for the job. So it's good to see you again, Representative. We spoke earlier today. It's nice to have members from the council. Representative, thanks for being here. And thank you for being here as well. And LG, it's always great to be with you and out of the office. We just wrapped up a tour of the vaccination clinic in Lawrence. It's serving older adults here in the community. And I want to thank the mayor for welcoming us here today and for the work that he's doing to get vaccines administered. I also want to thank John Silva and the team at Greater Lawrence Family Health Center for showing us around and for their work to operate the clinic, along with Ephraim Rolon, who's the director of the Housing Authority, and the team at the Greater Lawrence Housing Authority as well, which is the host site for the vaccination clinic that we visited. Before I discuss the clinic and the role it's playing in our larger strategy, I just want to give a quick update on COVID metrics. Yesterday, the Department of Public Health reported 1,553 new cases out of a total number of tests of 102,052, 755 individuals in the hospital. That's a 69% decline from the peak in January, and 173 individuals are in the ICU. On vaccine, over 1.2 million first doses have been administered here in Massachusetts, and over 1.8 million doses in total have been administered. We continue to be a leader in administering first doses among the 24 states that have more than 5 million people, and we're currently number one for first doses administered per capita within that group. We also continue to be a top 10 state for first doses administered per capita among all states. 70% of our residents over the age of 75, who are among the most vulnerable to COVID, have been vaccinated, which is about 10 points higher than the national average. And the Commonwealth currently ranks second for the percentage of black residents who've received at least one dose. We know there's much more work to do in communities of color, and that's part of the reason why we were here today. This week, we anticipate over 250,000 doses will be administered between first and second doses at all providers across the Commonwealth. That's about the same total as the week we're in now, and that's because we're getting about the same amount of vaccine from the feds. Earlier today, around 12,000 new appointments for next week at mass vaccination locations were posted and booked on the website. The number of new first appointments posted today for mass vaccination sites was lower than usual, while the overall number of slots for the week is pretty much the same. That's because residents are returning to mass vac sites for their second doses, and we have made progress to book appointments for older residents that called the call center because they weren't able to use a computer to book online or don't have access to the internet. The call center in the end ended up booking on behalf of these people about 13,000 appointments, who are people who would otherwise not have had access to secure an appointment. Due to the high trafficking that exists on the scheduling websites, users were placed into waiting rooms, and once they were allowed through, they were able to find and schedule appointments if they were available. And they went fast due to the massive demand that exists for those and the constrained supply that we're all living with, not just here in Massachusetts, but in many states around the country. I know that remains frustrating for everybody who's involved, who couldn't get an appointment booked this week. As we said at the start of this phase, it would probably take several weeks as we get more doses from manufacturers for everybody to get a vaccine appointment and get vaccinated. I want to keep in mind that residents over the age of 65 and those with 2 or more certain medical conditions are now eligible, and starting next week on March 11th, educators and staff and child care workers will also be eligible, which is an additional 300 to 400,000 people. So starting next week, there'll be approximately 1 million people who are eligible for vaccines in Massachusetts. The state's currently receiving about 150,000 first doses a week. We are not expecting that number to change very much over the course of the rest of this month. That means everybody who's eligible will be trying to secure an appointment with a relatively small number of available vaccines. And while we know that creates anxiety, I just want to continue to urge all of us to recognize and understand that we need to be patient here. We and other governors will continue to press the federal government to increase supply more quickly so that we can offer more appointments to people who are eligible. We understand that this is a large group of people who've become eligible with the addition of the educators next week on March 11th, but we believe it's critically important to continue to make possible vaccines for people who are over the age of 65 and people who have 2 comorbidities who are eligible as well for appointments. Those folks are particularly susceptible to illness, hospitalization, and in some cases death from COVID-19, and need to continue to be able to access the system and get vaccinated. We won't be diverting large amounts of vaccines from this group. Unfortunately, because we haven't been provided with any additional vaccine to specifically serve, at least at this point in time anyway, educators or school staff, and we haven't heard any guidance from the feds with respect to this at this point in time. We're hopeful that the federal government and the vaccine production folks will follow through on their promise of increased supply. Obviously, we'd like to see that happen sooner rather than later. Next week, I want to point out that a new regional collaborative will go live. The Lower Merrimack Valley Regional Collaborative will begin, which includes health departments from the communities of Amesbury, Georgetown, Groveland, Merrimack, Newburyport, Rowley, Salisbury, and West Newbury, and details on this collaborative will be up on the website next week. We're continuing to prioritize doses for some of the hardest hit communities here in the Commonwealth. As people know, last month, the Department of Public Health identified 20 communities that have borne the brunt of the pandemic of collaborations and partnerships that lead to success, and the full court press that's happening here through public, private, and nonprofit sectors is making a difference in ensuring that vaccines are available for people here in Lawrence. The Greater Lawrence Family Health Center will vaccinate over 100 older adults today at the senior housing site that we visited, and to date has vaccinated over 300 residents at Lawrence senior housing facilities, with plans to vaccinate close to 1,000 more in senior housing facilities across the city. But overall, Lawrence Family Health Center has distributed over 12,000 vaccines to date and are now doing close to 1,000 shots a day, and expect that number to increase over the next 3 or 4 weeks as they operate sites in Lawrence, Methuen, and soon to be in Haverhill. In addition, they're providing vaccinations to the homeless and to homebound individuals in this region as well. Another way we're supporting these 20 communities is through a $4.7 million targeted initiative to increase vaccine access and awareness. We recognize that vaccine hesitancy is an issue, and we know that it comes from decades of past experiences where communities of color did not have equitable access to quality medical care. Our equity initiative aims to overcome some of these challenges by working with local residents and trusted community organizations to reach people where they are and create access to the vaccine. The initiative is being run in partnership with Healthcare for All and Archipelago Strategies Group, 2 organizations that specialize in this kind of grassroots, hyper-local outreach, which among other things will involve hundreds of thousands of door knocks across these 20 communities in the coming weeks. This initiative is in addition to the $1 million we've invested in the Mass League of Community Health Centers to support community health center work, and will continue to involve culturally competent and multilingual outreach to promote vaccine awareness in these communities that are served by the CHCs. We're investing these funds this way because we recognize the importance of these neighborhood institutions like Greater Lawrence Family Health Center when you're trying to pursue an initiative such as this. They know the populations they serve, they know these communities, and they're well positioned to address the hesitancy questions and to help people get access to the vaccine when they are able and available to seek it and to get vaccinated. I also want to provide a quick update on our mass vaccination site at Fenway Park. As everybody knows, Red Sox opening day is coming up on April 1st, and our current plan allows fans in the stands with a strict 12% capacity limit. But with that in mind, we've been talking with the Red Sox, the clinic's operator, CIC Health, and other partners about the future of that site Today we're announcing that we'll transition the mass vaccination site from Fenway Park to the Heinz Convention Center. This transition will take a couple of steps, so please take note. The Heinz Convention Center will open and start accepting patients on Thursday, March 18th. Fenway's last day to accept patients will be Saturday, March 27th. So these sites will overlap for a couple of weeks. Both will be operating from March 18th to March 27th. All individuals that are vaccinated at Fenway Park and have a second appointment scheduled will be able to receive their second dose at the Heinz, and CIC Health will send them all the details via email, and there'll be additional outreach to make sure that they know where they need to go and when they need to be there. We're grateful to Fenway and to the Red Sox, along with CIC Health, for their incredible work operating this highly effective, friendly, welcoming, and efficient site. So far, they've completed over 25,000 vaccinations, and by the end of this month, we'll expect they have completed over 55,000 vaccinations. It's a terrific output, and we're deeply grateful to the Red Sox, Beth Israel Deaconess Medical Center, Cataldo Ambulance, and the other partners for everything they've done to support this effort. They've been terrific partners throughout this process. This month, the new Heinz site will ramp up to do the same volume of vaccinations as are currently being done at Fenway Park, which is about 1,500 a day. And later this spring, if our supply increases, the Heinz has room to scale up to more than 5,000 shots per day. And before I turn it over to Mayor Vasquez, I just want to thank the City of Lawrence and the teams at the Lawrence Housing Authority, the Greater Lawrence Family Health Center, for hosting us today and for the incredible work that people are doing here. We're supporting local leaders and community health centers in communities like Lawrence because you are the best positioned to serve your neighbors and help people get access to this critically important vaccine. We look forward to continuing to work with you. We look forward to continuing to expand your footprint as you and we work together to distribute vaccine and support this community. And with that, I will turn it over to the mayor.
Governor Baker, Secretary Polito, Lieutenant Governor Polito, Secretary Sudders, I welcome you back to the City of Lawrence. I also like to take this opportunity to thank all of our state delegation members who are present today, as well as local elected officials in the city. In the City of Lawrence, we strongly and firmly believe in collaboration, and for that reason, I am very grateful of the work that is currently happening with Greater Lawrence Family Health Center, as well as the Lawrence Housing Authority. This is what we need to continue to see. As you know, there has been a large hesitancy in members of our community to obtain the vaccines. And in order to ensure that they get it, it is important that we meet them where they are. And this is exactly what is happening today here in the City of Lawrence. I am also grateful for the collaboration we have had with Lawrence General Hospital, which has been very significant in ensuring that our residents obtain the vaccine that is desperately necessary in our community. Please note that the City of Lawrence is also aggressively pursuing opening our own vaccination site, which, similar to what the governor just said, I knock on wood that this will happen next week. And I am hopeful that the location will play an integral part in ensuring that residents will have accessibility to be able to get there. This is going to be at the Arlington School, in the heart of the city, in the Arlington neighborhood, where the most need is critical. The City of Lawrence also is aggressively launching its own advertisement campaign for this effort. And for that reason, tonight we are having a town hall in which we will be addressing any concerns from the residents, and it will have live interpretation to Spanish and American Sign Language. Residents will be able to ask healthcare professionals their questions directly, and it will be addressed to them to ensure that they feel more comfortable in terms of the vaccine. This is what we need in the city, and I wish we can continue to address this concern. There's a lot of inequalities that exist, and I urge the governor to continue supporting our efforts locally as we address the COVID pandemic and many other concerns in the city. I would like to take this time now to welcome Greater Lawrence Family Health Center CEO, Mr. John Silva.
Thank you, Mr. Mayor, and a shout out on behalf of from Greater Lawrence Family Health Center to our friends at Lawrence General Hospital. It seems like when things are, whether they're going good or they're not going, or they're going badly, we're always in the trenches trying to make things better. So I noticed some LGH folks here, and I wanted to make sure that they were mentioned. I want to thank Governor Baker, Lieutenant Governor Polito, and Secretary Sudders, not only for being here again, but for their constant leadership in terms of crisis. They may be dealing with the slings and arrows of outrageous fortune, but they keep striving along with thousands of people throughout the Commonwealth to get as many vaccines and as many services as possible to as many people as soon as is humanly possible, and I want to recognize that. I also want to recognize the recognition of our state's community health centers, the network of 52 community health centers that are playing an integral role right now in both the testing and the vaccination of our populations. Greater Lawrence Family Health Center has 60,000 registered patients. Out of those, about 45,000 are residents of Lawrence. The majority of the rest are residents of Methuen and of Haverhill. So I want to give you a quick snapshot as we move forward. We have provided, Greater Lawrence Family Health Center has provided over 13,000 vaccines beginning way back in December. Can anybody remember December? It was December 2020, and it seems like it was 5 years ago. We've been working with our entire staff and with local healthcare partners, and we've been following all prescribed state protocols. Our highest week was last week, where Greater Lawrence Family Health Center provided 5,000 vaccinations. We're the little engine that could, and we continue to chug along, and we're getting better as we move. We've conducted clinics in Lawrence, Methuen, Haverhill, North Andover. We have permanent vaccine clinics in Lawrence and Methuen, and we're soon going to be announcing a new permanent clinic in Haverhill. We expect that by the end of March, we will be providing 8,000 to 10,000 vaccines per week. Our sites in Lawrence, Methuen, and soon to be Haverhill are fixed sites running 5 to 6 days per week at each location. National Guard clinical teams, and thank you, Secretary Sudders, are assisting us in Lawrence and in Methuen through the end of April, adding temporary staff and volunteers to help us expand our efforts and locations, because manpower is vital. Hopefully we can maintain the National Guard resource into April and continue to do more and more vaccines every week. We have also provided numerous pop-up clinics to help complement our main vaccine sites. They are one-time clinics. These pop-ups have taken place in Haverhill and North Andover and have been done in conjunction with city governments and with elderly housing leaders, and we are looking at doing more now to help accommodate the need. Especially the need for getting our teachers vaccinated, since they've been added to the list of those eligible in the Commonwealth. And as the governor did mention, a lot of this is driven by vaccine availability. I believe the more vaccine that we can get, the more that we can do. The more that we can do, the more people will be immunized and will pass through this terrible period. The work we are doing at Lawrence Senior Housing, and God bless you, and God bless you and your staff for everything that we do. At Lawrence Senior Housing with the homeless throughout the Merrimack Valley and homebound is also an important part of our approach that we will continue to be committed to. We have an agreement with Lawrence Senior Housing to provide the vaccine at all of their locations in Lawrence. We're using our mobile health units to expand our outreach to the homeless throughout the Merrimack Valley. And thanks to DPH and the Bureau of Infectious Disease and Laboratory Science, we now have a second unit that will be used to expand our outreach. The one takeaway from this nightmare of the last 12 months is that the spirit of collaboration and partnership has never been stronger. Thank you.
You guys have questions for John or for the mayor? Start there. Okay.
Mayor, if you look at an article, you can see how important it is to have vaccination sites within your own community to be addressed.
I think that's definitely critical and very important to have vaccination sites near the community. In the city of Lawrence, we have to understand that many folks do not have access to accessible transportation, and it's important that we meet them where they are. And in addition to the location, I think it's also critical that we address concerns that individuals may have. As you know, there's a large immigrant community here in the city of Lawrence that might not necessarily understand clearly the information that is being provided, and for that reason, we're bringing healthcare professionals that can speak to these folks and address the concerns that they're bringing to get the vaccine. There's a lot of not factual information available on social media. A lot of folks rely on social media to get information, and that's not the way it should be. So we are ensuring that they get information firsthand from healthcare professionals, and they're met where they are. That's why we're opening our vaccination site, the Arlington School, which is in the heart of the city, in the heart of the poorest neighborhood, not only in the city of Lawrence, but possibly in the whole state of Massachusetts. We're meeting them where they are. Sure. La ciudad de Lawrence, muchos residentes en la ciudad de Lawrence tienen temor de la vacuna del coronavirus, y por esa razón nosotros aquí estamos haciendo un gran esfuerzo para poder hablar con ellos y ponerle la vacuna en los lugares donde ellos están localizados. Esta colaboración con Greater Lawrence Family Health Center y Lawrence Health Authority está haciendo correctamente eso, poniendo la vacuna en los residenciales de los residentes. Pero aparte de eso, vamos a abrir un centro de vacunación en la escuela Arlington para asegurar que estos residentes que no tienen acceso vehicular puedan tener un acceso caminando al centro de vacunación. Vamos a estar haciendo un town hall o un foro comunitario con los residentes para contestar preguntas que tengan acerca de la vacuna y aclarar cualquier duda que pueda existir con expertos en el tema de salud pública.
I think it depends a little bit on two things. One is how much vaccine does the president put through the federal pharmacy program, which he's talked about significantly increasing over the course of the next few weeks. And the second is how much vaccine do we get? How much vaccine is he going to give to states to follow through on that commitment? We obviously will put every shot we get through the network that's available here, which has 170 sites of one kind or another in Massachusetts, and make them available as soon as we get them. And at this point in time, we could easily do twice the capacity that we will do. We'll do 250,000 shots next week. We could do far more. But to do far more, we're going to need far more vaccine from the feds.
Governor, would you consider opening more clinics like 2 or 3 weeks out, just so that we could get more people in with that 150 being kind of steady?
Well, keep in mind that because we're playing a two-shot game with Pfizer and Moderna, you got to make sure you create the capacity to deliver the second shot. One of the big issues we face next week is we have a ton of second shots next week based on first shots that were given 3 and 4 weeks ago. So that is going to be a constant issue for us as we move through this. You can perhaps, if you think you're going to get the vaccine, but okay, so let's suppose we had made a decision in Massachusetts to believe everything we had been told about what was going to happen with respect to Pfizer, Moderna, and J&J, and it scheduled out 3 weeks based on what we had been told. We would be in really big trouble right now, because none of those vendors are actually playing at the level that they said they were going to be playing at a few weeks ago. And that is exactly why we have been very cautious about pushing this thing out beyond what we actually are permitted to order week to week.
Right, but it doesn't look like by the end of March. I mean, you said yourself, you're not even expecting any increases by the very end of March or beginning of April. So, I mean, is that really realistic to think that you get shots in every educator arm right now?
Well, I think unless there's a significant increase in supply coming from the feds, it's going to be hard to get through the current eligible universe by the end of March. Yes.
Governor, could you tell us why 13,000 appointments, some weeks it's 70,000, 13, is that because there are so many seconds, or you're holding some back?
No, a big part of it is there are a bunch of people who are, I think over 70% of the shots next week at the mass vac sites are going to be second doses. In addition to that, we're We're continuing to expand into the community health center communities as they develop and ramp up their capacity. And we've been doing the same thing with some of the folks in the provider space generally. I mean, remember, there are 170 sites that are currently available, some of which people can get to through our website, some of which people get to because they're patients of organizations like these.
Governor, of the 150 you get each week, and you're going out for next week, I mean, how many are allotted for second dose? I mean,
No, the 150 is not second dose. The second,
I guess I don't know, the 250, I guess.
yeah, the 250 is what we think of as the total universe of available doses. So we'll put 150 out that will basically be first doses, and there'll be another 100,000 on top of that that will be second doses.
150, they'll only be first.
Yeah.
And are you completely confident in the second, that you have enough for the second doses?
Yeah, I mean, generally speaking, it's a formula, right? So you report on the number of first doses you've done, and then you expect 3 weeks later for Pfizer and 4 weeks later for Moderna that you will get the second doses that you're supposed to get. And generally speaking, the formula works. The curveball in it is weather. We've had some pretty interesting experiences with weather. A couple of, was it literally just last Friday? It was just last Friday that we were calling everybody we knew in Washington to try to make sure that, it was on Thursday that we were making, it was a week ago today? That seems like 100 years ago, that we were making all those phone calls to try and make sure that we didn't lose the 130,000 doses that we were expecting to get to fill slots that had been booked on Friday, Saturday, and Sunday. Now, we got lucky and the feds were able to honor that commitment. But there's always a certain amount of unevenness to the way the vaccine gets distributed. But in theory, we are supposed to receive second doses on a schedule that's based off of when first doses are administered.
Are the mass sites, are they maxed out right now on the number of people they can deal with, okay, whether it be first or second? Are they at the max, or can they expand?
I think the provider sites, I think the community health centers, I think the mass vac sites, I think the regional collaboratives could all do more if there was more product. Yes, all of them could do more.
But there was only 12,000 days because of the second dose.
Well, remember, there were also a number of folks who had not been able, I said this in my remarks, there were a number of folks who had not been able to access a vaccination site because they were elderly and didn't use the computer. And so the call center actually booked a number of appointments for those folks as well, which will be part of the universe that gets first dose next week.
Governor, on Fenway Park, with just 12% occupancy, I was thinking, well, it'll be pretty easy to take one of the gates and sort of section it off and do it there. Did you consider that, or are you thinking long-term it's going to be more people and it'll be harder to do it?
I think there were 3 issues on this, and the Secretary and I had a few conversations about this, and I lost, which is pretty typical. The first thing is they don't just play games there, okay? They also practice there, and so there's going to be folks in the place moving around, using the facility for one reason or another that goes way beyond just the act of actually playing a game. The second is it does create a certain amount of potential for confusion for people who are going there to actually get a vaccine and there for that purpose only. Geez, maybe to have ball players in the park at the same time you have people in the park who are there for a different purpose, we just felt was a little more complicated than we felt was appropriate for this. And the Heinz is available, and it's not that far away, and it will have the ability to scale, right? And as the baseball season moves forward, and they're going to want to open up at some point some of the stuff along Yawkey Way, and I just think from our point of view, the Heinz was a more permanent solution that we could use on a go-forward basis.
Security issue, people might be able to sneak down the field and watch practice or whatever?
I don't know. But the bottom line was there's going to be, the fundamental purpose of Fenway Park is to provide a place for the Red Sox to practice and play baseball. They did a beautiful job of sort of visioning how you could actually turn it into a vaccination site. But with the Heinz available down the street and there to be able, the Heinz will also be able to scale up to a significantly larger number. without the distraction that would come with being part of a ballpark that's actually active.
To follow up on that, your 3 points about Fenway, you knew all that when you opened it up in late January and February. So what changed to do it now?
Well, a lot of things changed. First of all, we had tremendous drops in our positive test rate, tremendous drops in our hospitalizations, tremendous drops in our case counts every single day. I mean, January 2nd, I think 228 communities in Massachusetts out of our 351 were designated red. I think in today's data, it's 19. We're in a very different place now than we were then.
Your hybrid model for the State House, the employees, obviously the businesses around the State House are going to suffer. And you're talking about doing this after the pandemic?
I'm sorry,
The hybrid for some of the staff still staying at home even after we get through this pandemic.
well, I mean, look, we believe that there is absolutely an important element to physical presence, all right? I don't think anybody would dispute that. The Lieutenant Governor and I love every opportunity we have to go see people, okay? And I certainly believe that, once we move past the pandemic, there will be an interest in getting together. I just think a lot of people have learned that they can be enormously productive without spending 5 days a week in the office. And I don't think that's just true for us. I think that's true for many employers. And it's one of the reasons why we put out an RFP to find somebody we could work with on this whole question about where and how people are going to work in the future. Because I think it has real significant consequences for how we think about public policy. I don't want to make decisions about how we invest state money or federal money or how we work with the private sector or with our colleagues in local government about how we recover, how we try and build our way back out of all this without recognizing and understanding that some things are going to change. And that's going to be true for us as an employer as well, just as it is for others. A lot of people have figured out they can do a lot working remotely. They'd love to spend a few days in the office. They'd love to be involved in kind of the socialization associated with the teams that they work with. But there are a lot of people who think they can do a lot more than they were doing before by not spending 5 days in the office.
Last question.
Well, one of the big issues, certainly one of the big, there's a million issues associated with this, which is why we're trying to hire some smart people to help us think about it. But there was a story in I don't remember where I read it last week about New York that talked about the fact that New York City is going to be dealing with some of the same issues, and I happen to think it's going to be an issue for many municipalities. And I want to make sure that if this is in fact where the world is going to go, that we are doing the things to help those communities think about what their future looks like under that kind of a scenario, so that we're putting resources into the right places in the right way to ensure that they benefit from that change and that we don't miss it.
Essential workers who are said that teachers are going to be eligible now to get vaccinated while they still have to wait it out in it since the beginning of the pandemic. What would be your message to those folks?
That we felt we needed to be consistent with federal policy on this, that we knew the federal government was going to start making decisions about distributing vaccine through one of its major channels, the retail pharmacy channel, to support vaccination here. And we thought it would be hugely confusing if the Commonwealth of Mass was playing a different game than the game that was being played by the feds, and we thought we should align. And I get that creates issues and concerns for people generally, but what I would say is we are at the point in time where we can vaccinate as many people as we get vaccinations. So if the game changes here at the federal level and the feds start pushing significantly larger amounts of vaccine out, we are in a position now where we will be able to move very quickly to scale up to meet that supply and the demand that's attached to it.
Knowing that the CDC, the Biden administration's own CDC guidelines say it's safe for people to go back, knowing that, do you think it's unfair? I'm just following the guideline. Look, I think it's unfair that I can't
that I can't currently vaccinate everyone in Massachusetts who wants to get vaccinated. But it's a fact. It's a reality. Until there's more vaccine, we're going to be playing this waiting game. And what I will say is we should all remember that the combination of the federal government and a whole bunch of really smart companies, many of whom are located here in Massachusetts, did something that had never been done before. It produced a vaccine that works in less than a year to fight a global pandemic. I mean, this is an extraordinary accomplishment, and it makes it possible for us to create a safe remedy to a terrible scourge in a really short period of time. And I think it'd be great if we had more and could distribute more. And I hope that we do have more so that everybody who wants to get a shot can get one. But at this point in time, we're limited by the supply that's available.
The first J&J vaccines is limited by why is that first going to the hospital? One of the features is they can get out to the community.
Some of them went to the community. I don't know. Did you get some? Did you get some? You didn't. Some of them did go to community health centers as well. Pardon me?
Why the hospitals? They have the ability to...
Well, the biggest reason, it's very easy for hospitals to do one and done stuff, right? I mean, they don't have to change very much about the way they operate. Remember, we got told you're going to get this and then you get nothing for 4 weeks. It's very easy for the hospitals to literally just work their way through their most vulnerable patients, those over the age of 75, those over the age of 65, bang, 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 you know, and deliver 58,000 doses very quickly, and then they just go back to doing what they've been doing, either with Pfizer or Moderna or just taking care of patients. It's harder for some of these other sites that are built around this idea of 2 doses to just flick the switch and then all of a sudden have to flick it back.
Governor, it's well into the hundreds of thousands of dollars to operate one of these mass vaccination sites every week. I wanted to suggest, first, is the state expecting to get reimbursed for all of that from the feds? And then also, some local officials, local board of health officials, and lawmakers are questioning why invest in for-profit companies rather than take that money and invest them into local board of health, where the infrastructure could be built up and use it for future public health emergencies.
I think the biggest issue for us was efficiency, speed, and capacity to deliver in a very short period of time. I mean, remember, when we first started expanding our infrastructure here in Massachusetts, we had a lot of catching up to do. And this is a race against time. At the end of the day, it's a race against time. New variants, other concerns, everybody wanting to get vaccinated. We needed more. Every state in the country is creating large-scale sites in the race against time. And for us, this race against time required us to create a lot of additional capacity that could focus exclusively on one thing and one thing only, which was the delivery of vaccines. I'll tell you something. We get an incredible amount of incoming from people who access those mass vac sites. They are amazing ambassadors to the vaccine program.
So we're getting, this week you only have the 12,000, is that going to become the norm to reach that level?
It's going to depend to some extent on how many people 3 and 4 weeks ago got their first doses and are now getting their second doses. And it'll depend a little bit on what does happen with supply. And it will also depend on how these folks are doing. You got 170 sites. You got multiple channels here. And at the end of the day, one of the greatest challenges the command center has is figuring out how to make sure all of it lands where it's supposed to land, given that, some days we get this much, some days we get this much, some days we get this much, some days we get that much, and with some of the issues that we've had, which hopefully will go away around weather. It's not the easiest thing in the world to plot and plan. But I would say that I do think we will continue to make about 150,000 first doses available, if that's what we get from the feds, every week as part of the way we distribute vaccine to a universe that's significantly bigger than that.
We're getting to reports of some health centers having to cancel appointments this week or next because they're not getting the vaccine that they told they were going to be getting? Are you aware of any?
I'm not, but we'll follow up on it.
Thanks, everybody. Talk to you real quick, Governor, about funeral directors. I did a sad story this week on a young man whose dad died of COVID. He believed from a family who had another one of them that died. The CDC is a little innocuous with the documents, but the CDC supposedly has them slated as healthcare workers. You're one of the only states that doesn't. Has any thought been given, especially given the medical examiner's office being given vaccine, to allowing these people?
We've had an advisory board that gave us guidance on how to do this. For the most part, we've been following their protocols and their recommendations. Like I said earlier, I would like to be able to put everybody into the mix. But at this point in time, we're following a list. And the biggest thing on this list was people who are most vulnerable to COVID, which started with long-term care and a whole bunch of folks who serve people who are vulnerable to this as well. And that's where we started. And that's where, and unfortunately, there's a pace we can go at, and it can only go as fast as the vaccine that we get.
So was there a disconnect though of vaccinating the medical examiners to not funeral directors? A lot of times that's a very similar job, going to the hospital, going to nursing homes, dealing with it today.
A lot of the folks in the DME office end up on site, accidents, trauma events, that sort of thing. That's much more of a first responder type role, which, as everybody knows, they were a very high priority, not just here in Massachusetts, but around the country. Thanks, everybody.
Thank you.
And thanks again to the folks at Lawrence for the wonderful job you're doing collaborating.